Another day and the global death toll from the coronavirus pandemic continues to grow. Around the world, the coronavirus is bringing out the best and the worst of human nature. There have been fights at supermarkets over food and even toilet paper. There's been mistrust and misinformation spread across the globe, and in some parts of the world, there has been defiance to the advice on how to stop the virus from spreading. But it's not all bad news. There is a new appreciation for those fighting at the forefront, such as scientists, doctors, and nurses, and there are neighbors helping each other and people joining forces worldwide to beat a common enemy. And through it all, it's our role, the media, to bring you the facts about this global pandemic, to supply you with reliable information about the latest developments. Welcome to Corona Times with me, Ali Aslan, as we look at how journalists around the world report on the coronavirus. On today's program, I will be joined by Daniel Lippman, who is the White House reporter for Politico, and Elizabeth Moutet, a columnist for The Telegraph based in Paris, and last but not least, Tulasizwe Simelane from ENCA, a 24-hour TV news station in South Africa. All top-class journalists. They'll be talking about how the coronavirus is shaping the news coverage in their part of the world. Let's start with you, Daniel. This is obviously one of the biggest stories in years. What are the main challenges of covering this story for you personally?
I think the main challenge is that I'm used to meeting with sources for coffee and lunch and drinks, and I can no longer do that much. And so yesterday I went on a walk with a source in the Trump administration on the National Mall. But our bread and butter for me is scoops. And so you can usually only do that in a certain way most effectively is if you have face-to-face conversations with sources. And so now I'm pacing my apartment all day long on the phone, talk sources to get out interesting news that breaks news and moves the ball forward to help stop this pandemic.
Yeah, face-to-face conversations, I think, won't be happening for a while. And Elizabeth, what are the main challenges of covering this story for you?
I would say the same thing as Daniel, which is you don't meet people. The other thing is that if you are on the spot and you wait on the spot for news, 90% is waiting and 10% is actually seeing people, catching somebody that will tell you a few things that will lead you on to something else. And you can't do this anymore. So it's a bit like, internet keyboard warriors. It's a very strange way of doing news. But on the other hand, people help you. Colleagues and people you interview help you.
Tulasizwe, many challenges, obviously, that journalists are facing in covering this story. What's your take?
Well, Ali, for me, there are two sets of challenges. One, I'm more studio-based now. I used to be a field reporter, but now I'm more studio-based. It's about social distancing in a studio setup where there are shared surfaces and people need to get up close and personal with you to mic you up, to do makeup and those kind of things. And you constantly having to remind people that now it's not business as usual. We need to keep distances. Even as we try and do this, we need to sanitize those surfaces. The second challenge for me is I get quite anxious because of the time I spent reporting on the field. I'm quite anxious about social distancing for my colleagues who continue to work on the field, seeing many of them not using those boom mic extenders to keep a distance between themselves and the people that they are interviewing is really worrying me at this moment.
Yeah, no longer business as usual indeed. To some extent, the media's job is to separate the truth from the myth, the relevant from the irrelevant. For those of us in the media, the story these days is primarily about the response to it, whether that's from global leaders, those on the front line, or those caught in between.
We're at war. In a true sense, we're at war, and we're fighting an invisible enemy.
It is time to put armed conflict on lockdown and focus together on the true fight of our lives.
The world is being told to stay home, but in the early days, many people didn't grasp the gravity of the outbreak. Unfortunately, Italy has paid a high price for complacency.
Non avremmo mai pensato.
We would never have thought that in our country, in these days, we would have watched long convoys of military trucks carrying the coffins of our fellow citizens.
A hard lesson learned, and a mistake other leaders have directly ordered their communities not to repeat.
From this evening, I must give the British people a very simple instruction. You must stay at home.
In a more creative effort to capture the nation's attention, Liberia's president has released a song about combating the virus.
All right. Let's stand together to fight Corona.
Ugandan presidential hopeful and pop star Bobby Wine has done the same.
Discipline and personal hygiene, and make sure you regularly wash your hands.
One local government in Pakistan is pushing the importance of personal hygiene in a video. It's a man gaining superpowers after washing his hands. In remote Indonesia, where electricity and the internet aren't always available, doctors are getting the message out any way they can. Regardless of how it's communicated, the official warnings are the same. Wash your hands, keep your distance, and if possible, stay at home.
Well, we saw there how those with a platform are getting their message across, whether it's through press briefings or appealing to the public directly through things like songs or cartoons. And Elizabeth, how are you striking a balance these days between being too alarmist but also not causing unnecessary worry?
It's, to some extent, what you do is you try to have facts and check your facts. And whenever you see something that is, worrisome, such as, for instance, the fact that 30% of the French now believe that this virus was created in a laboratory for, unnamed evil purposes. Whenever you see something that would create sort of conspiracy feelings, it's something that you need to be aware of and to debunk, and always have a sort of sidebar or something explaining, this is why it's being believed, or this is what people are saying. And these are the facts that we have from the World Health Organization. These are the facts that we have from the doctors we've interviewed, and try to compare this all the time, because there is this worry. The other one is to try and stay away. It's difficult, but to stay away from the political exploitation of the crisis. And there have been reproaches in France against the president because the French doctors, it took them 2 weeks to get face masks. We had problems with hydroalcoholic sanitizing gel. We have problems right now with respirators. We haven't got enough. And the whole thing becomes a kind of political football. And what's interesting too is that you can see, and you can follow this on Twitter and social media, and that sort of try and feeding back in your stories. You have some political personalities who have tried to make hay of this early on, and they've been absolutely killed on social media. Ségolène Royal, the former presidential candidate, has gone on the attack directly on the president, and it's not helped her. So we were trying to keep the politicians on the sort of straight and narrow, if you will.
Not an easy task these days, that's for sure. Tula Sizwe, sensationalism is what we see in some form of journalism these days. How do you prevent that from happening? How do you focus on merely the facts without trying to spread fear, without trying to convey the impression that this is the time to panic?
It's quite difficult, Ali, but I think it has helped that for a change, our government seems to have stepped up quite early on with an appreciation of the magnitude of the challenge, particularly in our circumstances in South Africa. We have unique circumstances, as you will know. The HIV infection rates and people who are living with HIV is quite high in this country. Add to that, we've been dealing with the burden of TB as a disease on its own. So there was a quick appreciation on the part of government that while the death rate of coronavirus, COVID-19 elsewhere may be relatively low, 2%, 3%, thereabouts, but if it spreads to poorer communities of South Africa, high density populations in South Africa where people are already immune compromised, it will be a massive catastrophe. So that has helped everyone to be on the same page, that you are not exaggerating. This is the fight of our lives as a country. And also, in as far as our economy is concerned, of course, our economy, the growth has been negligible. In fact, we are in a recession for the second time in 2 years. And now there's an acceptance that we are going to be in a recession for much, much longer. That helps us in that, no one can really say that you are exaggerating. I mean, the sight of our president, President Ramaphosa, the fifth president of democratic South Africa, in full military fatigues, something unprecedented. The other presidents didn't have to do that. He also used those words of the US president to say that we're a country at war against an unseen enemy.
Daniel, how do you strike that balance between just reporting and focusing on the facts and not contributing to the hysteria out there?
Well, I try to stay away personally from reading Twitter much during the day, not checking it very often, to not have Twitter affect how I write about the news. And I think my focus has been on how the Trump administration and President Trump, they failed to act on key warning signs. The Department of Homeland Security, they stopped doing pandemic modeling a few years ago. The President Trump, he was warned, his administration was warned in a transition exercise between Obama and Trump about a massive pandemic like this. And they didn't seem to really pay attention to the warnings, or they were dismissive. And so my perspective has been trying to find those untold stories and get them out there as a way of holding President Trump accountable. And so I'm not as much focused on the day-to-day in terms of the numbers or kind of feeding into the hysteria. I'm more stepping back a little bit.
Focusing on the untold stories. Now, in many places, the coronavirus is bringing out the best of humanity. People who are doing shopping for their socially distant neighbors, supermarkets opening just for old and vulnerable people, and parents showing endless patience to homeschool their little ones. Well, unfortunately, not everyone is quite so sane.
A race to the bottom. Supermarket brawls and toilet paper feeding frenzies have become shamefully common as the world grapples with how to react during a global pandemic.
I've been coming up every day, and I can't remember the last time I was able to buy toilet roll on the shelves.
Stop hoarding. I can't be more blunt about it. Stop it. It's not sensible. It's not helpful.
There are empty shelves in England and Russia. Looting has taken place in Mexico. And price gouging is being reported right across Africa.
I think if the food prices continue going up, no one will survive because not many people will be able to afford to buy it.
In some countries, people are still struggling to come to terms with isolation orders. The military has been called in to enforce curfews in France. In India, police are dishing out public punishments. But along with the fear and chaos are extraordinary acts of kindness. People who've ditched their day jobs to sew face masks. Bookstores giving away free reads to those stuck in quarantine. And this in numerous countries around the world. Nightly applause for the medical workers, putting their lives on the line to save ours.
Well, despite what we just saw there, for some people, the message just isn't getting through to Lasizwe. What are you finding to be the best way as a journalist to tell your audiences on how to stay safe?
So I must start by saying that in terms of the message not filtering through, it seems that we are seeing a lot of that in South Africa. As I speak to you, the South African National Defence Force deployed on the streets because we are on a 21-day lockdown. South Africans have a tendency to really value their liberties because of our past and how we were deprived of those. People don't take too kindly to being told what to do. So when you say to them, stay at home, a lot of people, particularly in the townships, the high density areas of our country, a lot of people defying that. And that's really causing problems. And that phenomenon of people queuing to get inside supermarkets to try and stock up on supplies also brings to the fore another dimension of income inequalities in this country, because those who are well off were able to shop in the days before the lockdown, but other people had to wait for payday, and now they're trying to go to the shops only to find that queues are forming there. It's a difficult one, and I guess what we've been doing as a channel is really to emphasize the message, to say that let's sacrifice our liberties now, because we really don't have another antidote to this situation other than breaking the contact between humans, between those who are infected and those who are not yet infected. Sacrifice the liberties now so that we can enjoy them later. It really is that simple a message. It's been about that and really hammering that home.
Daniel, do you think as a journalist it's your job to tell people to be disciplined in times like these, to stay home, to keep their social distance? Do you think that falls within the realms of what a journalist has to do these days?
Yeah, I think we are kind of representatives of the public, and so we in one of our newsletters we say stay at home but read our newsletter, and so that is kind of a message of telling people that they have a very important role to play, and that and I think also doing stories about, say, those spring breakers in Florida who got a lot of attention, who were partying while this virus was raging. And kind of spotlighting things where people are violating these norms, and also pointing out to President Trump, hey, in those press briefings that you have every day, you're standing so close to each other. And so that all of those messages, they kind of filter through to people. And so we're holding those people accountable for their own recommendations from the Centers for Disease Control and Prevention.
And Elizabeth, the pictures that we're getting from France, from Paris, is deserted streets. People seem to be sticking to the social distancing rules. Do you think that's also due to journalism, to journalists like yourself?
I'm sure it's due to coverage anyway, and we're small cogs in the coverage. You have areas in France where people did not keep to the social distance. One was early on a large evangelical meeting in Alsace, in eastern France, and the result we can see in the figures of death and casualties, and so many people who need ICU beds that they need to be ferried by military plane or a special high-speed train. And that's very visual, and it brings him home the fact that if you do not follow this, things will happen to you. And like in South Africa with the townships, we've had problems in high-density areas with less following of the rules. And we have right now the second spiking area is just north of Paris, the Seine-Saint-Denis, which is a difficult area with not enough money, not enough jobs, projects, and lots of new immigrants, many of them illegal. And the result is they are still in the streets. And one of the reactions, which frankly is sort of shocking, is that when the police try to enforce the fact that when we go out in Paris, we are only allowed 1 hour, and we need to have a statement with the time and the day of why we're going out, of a small list of things that we're allowed to do, from walking the dog to shopping. And instead of producing this, they've taken to spitting on the police who don't have masks. And the police, understandably enough, have started standing back from this. And the result is that right now, all the ICU beds in Seine-Saint-Denis are occupied, and lots of ill people have to be ferried to other places in France because the rules were not respected. And I think this kind of coverage brings home to people that there are immediate consequences if you do not follow the rules.
Traditional media and our journalists on this program are using and helping to get the message across, but social media is also being used to amplify the voices of the masses and spread those key messages. All over the internet, we've seen lovely stories of humanity and people joining forces, but not everyone is reading from the same script.
We are doing our part. Please do yours. Please stay home.
One simple public health plea echoed across social media.
Stay home.
The World Wide Web has become a weapon in our global fight against the new coronavirus.
You will only have one chance at this. Stay at home.
Videos like this one, direct from medical staff in Northern Ireland, have been shared and retweeted millions of times. If these serious messages didn't strike a chord, a who's who of famous faces have been giving health advice with a celebrity spin.
He's 93. If I get the coronavirus, I'll probably be okay. But if I give it to him, he could give it to Carl Reiner, who could give it to Dick Van Dyke. And before I know it, I've wiped out a whole generation of comedic legends.
And when it comes to hand washing, well, perhaps Neil Diamond says it best.
Don't touch me, I won't touch you.
Or maybe old school Oasis is more your style.
In a champagne supernova in the sky.
Whatever it takes to get the message across.
And everyone should do that. Everyone should wash their hands at least 20 seconds and do it as many times as possible. I wash my hands a minimum of 50 times a day.
But if the clever songs, celebrities and even the Terminator aren't enough to get people to take it seriously, maybe some straight talking will.
Da casa non deve uscire nessuno. E a Messina non esce nessuno perché c'è un'ordinanza e quindi guai chi esce da casa.
Dove andate con questi cani che hanno la prostata infiammata? Dovete stare a casa! Non avete capito che la gente muore! Volete far ammalare tutti! Siete degli irresponsabili, dei cretini!
Well, a lot of the material we just saw there is from Europe and the US and shows how non-traditional media is being used these days. And do you as a journalist find social media to be a blessing or a curse in times like these? Is it perhaps even helping you to do your job?
Oh, it's been helping me for years, and not all social media, but yes, it is, first of all, because you get the immediate temperature of what people are thinking. You try a hashtag and you see how people react to things, and it gives you ideas for stories. When you realize, for instance, that people really believe that this was all created for some strange evil, whatever sort of world domination outfit, you go back to this and you start asking people. You even sometimes ask pollsters to confirm your hunt. The other thing is that using reactions is very useful as a kind of breathing space in a story, especially since we can't go out and interview people in the streets. But also you get information through social media, and sometimes it's not information you like, but it's useful information because it tells you how to react to where the coverage is obviously not getting through. So I found social media very useful for a very long time, and the variety of people in social media, if you have a large enough list of people you follow, especially on Twitter, that will always teach you something that you would not have learned otherwise, because it would not have filtered through the things that you sort of concentrate on. So I find it very useful.
Daniel, would you agree is for a traditional journalist such as yourself, is social media not so much a competition, but rather complementary to what you do?
Yeah, I would agree with that, Ali. I get tips via direct message on Twitter and on Instagram. I get story ideas from following a number of people on social media who are trusted journalists who are good at aggregating the news. But if you are paying attention to social media all day long, you're going to miss the story. And also, if you're just a consumer of news, you're going to think that the world is ending, even though we know that this is not going to kill every person on Earth. And so I think reading actual stories instead of just tweets, that's also important.
Tolasiva, your take?
I just think that social media is helpful in being there where we can't be, being our eyes in parts of the country where we can't reach, and highlighting those instances where there's perhaps a loophole that officials need to be paying attention to. But also it's about vigilance as well, because with part of the deployment of this military personnel on the streets, there's a history and context, a painful history in South Africa, and people are wary of their rights being violated, for example. So there's that campaign of vigilance, as well as monitoring the stupidity of some people as well, people who are out there when they shouldn't be, gathering in large crowds. A lot of that has filtered through social media and has been reported to officials, with the result that under the new regulations, officials have been able to act immediately. So we've had one or two people who posted their videos on social media doing what they're not supposed to be doing, who are now facing censure.
Well, clearly this story is going to be with us for a while, but unfortunately that's all we have time for on this week's Corona Times, the program that looks at how journalists cover the one story that got us all talking. Thanks to our guests for their time today. Once again, they were Daniel Lippman from the US and Elizabeth Moutet from France, and last but not least, Thulasizwe Simelane from South Africa. The role of the media is very crucial at times like these, and we want you to hold us to account. So if you do have any thoughts on what we should be doing more of on coronavirus, or perhaps even less, do get us in touch with us here at TRT World.